Hello, everyone, from a rainy and windy St. John's, Newfoundland and Labrador. My name is Janet Herron, and I am an Alumni Engagement Officer at Memorial and your host for today's MUNalum 101 webinar on sleep. I'm here with Dr. Sheila Garland of the Faculty of Sciences Department of Psychology. For those of you, I know those of you who are attending can't see who else is in the room for the event, but we have a full house. We have had over 350 registrants for this event, and we have over 110 people on the call right now, and that is climbing every second. I'm getting a dopamine hit every time I see those numbers go up. So that is wonderful. We're really excited. We will begin today's event, as always, with a land acknowledgement. We acknowledge the lands on which Memorial University's campuses are situated are in the traditional territories of diverse Indigenous groups, and we acknowledge with respect the histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. We encourage everyone to reflect on these lands from where you are located and the Indigenous peoples for whom these lands are traditional territory. There we go. At the Office of Alumni Engagement, we are focused on offering ways for you to connect with Memorial from anywhere in the world and are working diligently to create opportunities to celebrate, socialize, mentor, learn, and advance both your career and improve your life. MUNalum 101 was born out of the need to reach out to alumni during the height of the pandemic, and it has since evolved to become a cornerstone of our alumni engagement activities, offering the latest information on key topics from Memorial University's own experts like Dr. Garland. Embarking on new and exciting ways to build relationships within our Memorial family of over 100,000 members are vital to our evolution as an institution. Alumni are the drivers of economic, social, and cultural development across this province and beyond. A quick aside, just wanted to mention that it is Giving Tuesday today, and donations made today to support students will be matched up to $10,000. So go to the MUN homepage at www.mun.ca and click on the banner if you would like to know more or wish to donate. Thank you so much for joining us today for our discussion about sleep, a topic that is near and dear to everyone's hearts, as evidenced by the huge response to this webinar. Just a few quick housekeeping issues. For those new to WebEx, there is a layout button towards the top right-hand side of your screen that gives you options on how to view today's presentation. Dr. Garland's formal presentation will be followed by a moderated Q&A session. You can find the Q&A function at the bottom right of your screen. And so please use that option to type out questions and don't leave them to the last minute, as we have only a limited time to take questions. If you post questions in the chat, please direct these to the host rather than to the panelists so that I can see them and Dr. Garland doesn't have to be looking for those because she's got other things to do today. And all audience members are not able to unmute your microphones or turn on your video. So the only way that you can communicate with us is through the Q&A or the chat. We are streaming live and we are also recording this session. All registrants will receive a link to the event and a follow-up email. So if you have to leave early, don't worry. You will be able to view the entire event later at your own convenience. A final note to say that Dr. Garland is unable to provide specific advice for individuals, so please keep this in mind when posting questions, which should be general in nature. It is my great pleasure to introduce our special guest today, Dr. Sheila Garland. In addition to her role as an associate professor of clinical psychology and oncology at Memorial University of Newfoundland and director of the Sleep, Health, and Wellness Laboratory, Dr. Garland is a registered clinical psychologist. She maintains a small private practice and has expertise in the treatment of insomnia and other sleep and mood disorders. She regularly works with individuals diagnosed with cancer and their families to manage the psychological effects of the cancer diagnosis and its treatment. Dr. Garland received her PhD in clinical psychology from the University of Calgary and worked with individuals with cancer and their families in the Department of Psychosocial Services at the Tom Baker Cancer Center. She then completed a 3-year postdoctoral fellowship in behavioral sleep medicine and integrative oncology at the Perelman School of Medicine at the University of Pennsylvania in Philadelphia. I will now turn the presentation over to Dr. Garland and give her the control.
Thank you very much, Janet, for the wonderful introduction. I think you'll need to allow me to share my screen again. There we go, thank you. Okay, one second while I get things loaded. Perfect. So thank you, everybody. Thank you for joining me this morning. We're going to talk today about sleeping for success and how sleep powers our body and our mind. So we have some learning objectives. So we're going to spend a little bit of time just sort of talking about what sleep is. We might kind of take for granted that we know what sleep is because we all sleep. But when we get into it, sleep is very complex. I'm going to take you through some of the research that just provides some key highlights about how important sleep is for our health. And then I'm going to describe some common sleep disorders, some ways that sleep can go wrong. And then I'll end with some strategies for anybody who is looking at getting better sleep, so you can take home some new things to practice over the holidays. So I think we want to start out just by talking about what sleep is. And so as you can see from my pictures here, sleep is pretty universal among the animal species. But when you think about it from an evolutionary perspective, sleep really appears to be a pretty foolish thing to do for a number of reasons. If we're sleeping, we're not hunting, we're not gathering, if we are sleeping, it makes us vulnerable to predation. We're not able to defend ourselves. We can't use this time to find a mate. We can't use it to reproduce. So, despite all of these potential negative consequences of sleep, practically every species that we've studied so far has its own version of sleep. So that means that it's serving a very vital purpose. We're really now only starting to appreciate how vital it is for sleep and the entire organism. There doesn't even really appear to be one major organ or process which is not impacted by sleep. So first of all, I want to take you deep into the brain, and I want to talk about sleep states and stages. So when we sleep in two general states. The first state is rapid eye movement sleep. That's called REM sleep. And the next state is non-rapid eye movement sleep. So these are the two states. Now, when we are in rapid eye movement sleep, it is described by its key feature, and that is where even when our eyes are closed, our eyes are moving very fast back and forth. Rapid eye movement sleep has a number of other particularly unique characteristics. So it is accompanied by our most vivid dreams. It's not the only stage of sleep that we dream in, but the dreams that we have during rapid eye movement sleep are more likely to be very emotionally charged. They're also more likely to be very detailed and complex because the electrical activity in our brain during rapid eye movement sleep is very similar to the activity of our brain when we're awake. So rapid eye movement sleep is where we're processing a lot of the emotions, the experiences, the events that we've had during the day. It's associated with a lot of the emotional regulation, memory, cognitive processing. So it has a very, very important function, both in terms of emotional regulation as well as cognitive. Now, when we are processing all of this information, it's pretty important that, we are not necessarily able to act out our dreams. Sometimes our dreams are just like hodgepodge combinations of, things that we remember as a child, things that, are completely far-fetched, jumping from high buildings or flying or something like that. So our body has this protective mechanism whereby it actually paralyzes us when we are in REM sleep. So this is what has been termed in folklore to be, the old hag syndrome, or, but it's actually just called sleep paralysis. And so what it is protecting our body. So if we are able to process these vivid emotions and we are able to do these wild and crazy things in our sleep, and we're not as at risk of acting out these behaviors when we're sleeping. So, for anybody who has experienced the old hag or sleep paralysis, it's basically when this part of your brain and the deep, brainstem that shuts off your ability to move your major muscle groups hasn't woken up before the front part of your brain that is more in control of your awareness. So that's just more of a timing differential. But you can see this also in a lot of other animals, right? Anybody who has pets at home, can see when their dog or their cat is in REM sleep. You'll see like the whiskers twitch. You might see the toes of their feet, kind of twitch like this. So they're having the same sort of dream activity that we would be having. There we go. Then we would move into the non-rapid eye movement sleep. And this includes 3 stages. So we start out right here, as you can see with our brain waves, in the relaxed wakefulness. And so the electrical activity of our brain, this brain waves, when we're awake, when we're kind of relaxed, it's very, very tight, very close together. This electrical activity is very condensed. As we start to progress into deeper sleep, we start to see different patterns of electrical activity, different brain waves start to emerge. So when we go into our lightest stage of sleep, which is stage 1, we have a very low arousal threshold. So this means if somebody calls our name, if somebody slams the door, we're more likely to wake up. Sometimes we can even misperceive that we're not sleeping when we actually are sleeping in this lighter stage of sleep. So that's what that sleep state misperception is. We actually are sleeping according to our brain waves, but we may not perceive it to be of sleep because it is a light sleep. It is also when we experience what's called hypnic jerks. So, if you've been watching a partner or something like that, you see them kind of twitch, or you yourself are falling asleep and you feel your body kind of like twitch, that's a sign that you're going into stage 1 sleep. And so then from stage 1, we would move into a deeper stage of sleep with a higher arousal threshold. And you see here with stage 2, you see even different types of brainwave patterns emerging. We spend the most time in stage 2 sleep. And then we move into our slow wave sleep. And you can see stages 3 and 4 here. The slow wave sleep, our brain waves are very high in amplitude and very, very spread out. So this is what's called the deep sleep, slow wave sleep, or delta sleep. That's characterized by the type of brain waves that appear during this time. So the delta sleep is more associated with the physical repair and restoration. So our brain waves, so you can imagine and think of our brain as basically offline during this slow wave delta sleep. So it's really more focusing on the physical repair and restoration. This is the stage of sleep where a lot of growth hormone is pumped out in kids. A lot of the immune regulation is also happening during this time. So the brain is actually sort of prioritizing different things during different stages of sleep. And these stages of sleep, as you're going to see in the next slide, happen at different times of the night. So this is a picture called sleep architecture, and it's basically how we move through these stages of sleep throughout the night. So you'll see here we have, a brief period when we're awake prior to falling asleep. And then we fall down into our stage 1 sleep. We spend a little bit of time there, go into stage 2 sleep, have some slow wave sleep, deep sleep here, come back up, have a brief period of REM sleep, bypass stage 1, go in, spend some more time in stage 2, have some more slow wave sleep here, come back up, a little bit more REM sleep, then we wake up, go back down, don't get quite as deep, but then we come back up, have a little bit more REM sleep, go back down, have another awakening here. It doesn't last very long, but go back down, come back up, go back down, come back up. So our brain is sort of moving us through these various sleep stages throughout the night. Now, if I put a line right through the middle, as I've done there, and compare the first part of the night with the last half of the night, you can see some differences in where we spend larger concentrations of time in what sleep stages at different times of the night. So the first chunk of sleep that we get is more focused on the deep sleep, as you see. So we're getting more deep sleep in the first part of our sleep period. And so that's really where it's like, again, prioritizing the physical repair and restoration. And then if you look at the last part of the night, you see that we're getting more REM sleep in the last part of the night. And there's some really important reasons for why our night is split up this way. So if we're not able to have a complete night of sleep, right, then at least our body is prioritizing the physical repair and restoration in the first part of sleep that we get. So we're getting our deepest sleep, we're getting the sleep that is is going to make our body, feel the best. Now, the REM sleep is more focused in the beginning of the morning hours, the latter part of the night. And that's because our brain has an easier time transitioning from a REM sleep to being awake because the brain waves are much more similar to each other. The brain doesn't have to do as hard of a job trying to like wake itself up, right? If you can imagine how difficult it would be for your brain to go from that really deep, slow wave delta sleep to being very, very fast awake. You probably have experienced how hard this is if you wake up from a nap that was too long and you actually feel worse after having that nap. You probably woke up more likely into that deeper sleep. Whereby, if you properly time a nap, you can make it so your brain is more easily able to transition from either a lighter stage of sleep or REM sleep prior to the time you wake up. And this is also why we're more likely to be dreaming when we wake up. And so we're more likely to remember our dreams because the dreams happen in the morning hours. So it's really helping our body be able to do important functions at different times of the night. And it also allows us to have periods in the night where we're more able to respond to either physical, environmental threats or internal things, right? So I've had patients come to me and say, like, I just want to like go into deep sleep and I just want to stay in deep sleep. And, although that might be desirable, it might feel like that's what you want. You actually want to have periods during the night where you're more able to respond to things that might need your attention. So this might be, a baby crying, it might be a car alarm, it might be, a smoke detector, something else like that. If you're in deep sleep and you're really kind of gone to the external environment, again, that's not very evolutionarily productive, right? So we have to have periods during the night where we are more able to be aroused to the demands that we might have. So that's another reason why we're cycling through these various sleep periods. So it has not only a biological reason, but it also has an adaptive reason why we would cycle through these. Our sleep does change across the lifespan, particularly the amount of time we spend in the various sleep stages. So just to orient you here to this figure that I'm showing, we've got our total sleep time here. And then we have our age here at the bottom. And then each of these different colors represents one of those sleep stages that I was just describing. So you can probably see the biggest change that happens as we age is the amount of time we spend in that slow wave sleep, the delta sleep. And again, as I mentioned, the delta sleep is responsible for the physical repair and restoration of the body. So this is very important, and you can probably understand why kids, they heal like really quickly, right? They have this amazing thing to just, basically, fall down and bounce back up. Whereas, as we age, it takes a little longer for us to heal. And this stage of sleep is one of the contributing factors. We're just not spending as much time in this restorative stage of sleep as we age. So that contributes to a harder time for our body in physical repair and restoration. The amount of time we spend in stage 2 sleep is relatively the same, but the amount of time spent in REM sleep is relatively the same. This is why we can still be cognitively very sharp and intact, even when our body is physically failing us. Yeah, one of those really unfortunate features of aging. We do spend a bit more time in stage 1 sleep, but one of the things that we do a lot of is spending more time awake in bed. So that's one of the behaviors that changes, is, we spend more time sort of lying there, whether it might be trying to fall asleep or awake in the middle of the night. And that can represent a sleep disorder, which does increase as we age. And so we'll talk a little bit more of those. So this is probably the most depressing slide that I present, is the one just basically saying like, part of the reason why our body doesn't function as well as it used to is because we are spending less time in our restorative sleep stages. So if any scientists out there find out how to increase or maintain that amount, they could have the secret to everlasting life, maybe. So I get this question a lot. How much sleep do I need? So when we look at population-based estimates, this is the best that we can do. And they are going to be different depending on what age you are. So this is where we've got estimates going from newborn to older adult. The blue part in the middle is the range, right? So if we're thinking about adults, the young adults, anywhere from 6 to 11 hours, adults 26 to 64, it's anywhere from 6 to 10 hours, and older adults anywhere from 5 to 9 hours. And, there is no magic number. 8 hours is not the, kind of the gold standard. It really is however much sleep you need to feel like you are able to function optimally the following day. But the trick is determining what that functioning optimally means. And also, there's a lot of other things that happen in our day that influence our energy levels and our perception of our energy. So for example, you could sleep 8 hours and then go into and feel good, but then go into the office and see that you have 150 emails to answer and then feel like, oh, I'm exhausted, right? Even though you got a sufficient amount of sleep. So it's not always due to sleep, but sleep is one of those factors. So why is sleep important for our health? And this is where sleep gets really, really fascinating. So the first reason why we sleep is repair and restoration of the body. So when we look at something as simple as the effect of sleep on the likelihood of catching a cold, this is a study that recruited 164 healthy men and women. And then these participants were actually quarantined in a hotel, and then they were given nasal drops containing a rhinovirus, which is just a cold. And then they were measured and monitored over 4 days to see, or 6 days, I'm sorry, to see whether or not they developed a cold. So overall, shorter sleep duration, where we see here is the less than 5 hours, was associated with an overall higher likelihood of getting a cold. So people who slept less than 5 hours were 4.5 times more likely to catch a cold than those people who slept greater than 7 hours. This also held true for those people who were sleeping 5 to 6 hours. They were 4.2 times more likely to get a cold than those sleeping 7 hours. There was not a statistically significant difference between those people sleeping 6 hours to 7 hours compared to those people sleeping 7 or more. So, this is really fascinating. There seems to be something going on there at that 6 hours. And so that was also sort of borne out in the how much sleep do we need slide that I just presented. So now let's look at the impact of sleep on the regulation specifically of appetite hormones. So this study compared appetite hormones in those people who were restricted to either 4 or 4.5 hours of sleep, and then they compared those people to those who were allowed to sleep 8 or 8.5 hours of sleep for a period of 6 days. So the first hormone that we're going to look at here is a hormone called leptin. And leptin is a hormone that is secreted from like the white adipose tissue, so white fat tissue. And it's a signal of fullness or satiety. Now, leptin, as you see here in those individuals who had the 8-hour sleep, they're represented by the black. Leptin levels has this sort of like consistent 24-hour rhythm, and it peaks at the nighttime there where you see the arrow. So here, leptin levels in the sleep restricted group, shown by the orange bars, were consistently lower overall than in the 8-hour group. So this suggests that the insufficient sleep may alter somebody's ability to regulate their appetite at night. So they're not actually feeling as full. Now, if we look at ghrelin, ghrelin is something that promotes hunger. So if you want to tell the difference, like grr, I'm hungry. That's how I, kind of remember ghrelin versus leptin. Now, under normal circumstances, ghrelin concentrations are rapidly suppressed following a meal. So you eat a meal because you're hungry, and then the ghrelin goes down, so you're not hungry anymore. And then it rebounds sort of as you see the periods going up like that. Now, overall, lower levels are better, but you can see here in those people who had less sleep, again represented by the orange bars, their ghrelin is overall higher at all time points throughout the day. So those people who were restricted to 4.5 hours sleep had higher overall ghrelin throughout the day. And then last is a very interesting appetite hormone called 2-AG. So this is a newly identified hormone that is related to pleasure eating. So this would be going for foods that are high in fat, high in carb, high in sugar. So hedonic eating, not eating because you're necessarily hungry, but eating because it feels good. And compared to those people who were allowed to sleep for 8.5 hours, the 2-AG levels were elevated throughout, especially during that period when people are more likely to snack. So in the early evening hours. So it was associated with reduced ability to inhibit that snacking. So this has important implications for overall health, weight, so important. Now, we know that sleep is especially important for learning and memory, but one of the most important recent discoveries about sleep was that it literally cleans your brain. So during the day, proteins linked to neurodegenerative diseases, including beta amyloid and tau, they're present in the interstitial space surrounding the cells in the brain. Now, when you sleep, there's a 60% increase in the interstitial space. So this allows for the exchange of the cerebral spinal fluid and the interstitial fluid. And then this exchange allows for the removal of these potentially toxic waste products that have accumulated throughout the day. So this has really important implications for the protective effect of sleep against the development of these neurodegenerative diseases. Lastly, we all know that we can get a bit grumpy when we haven't slept. So this is a study where subjects were either sleep deprived for 36 hours or allowed to sleep normally. Then they were asked to learn a series of emotionally negative, positive, or neutral words. Then they were allowed to sleep again, and then they were tested on how many of these words they retained. So in the first graph here, across all of the emotional stimulus types, those who slept normally had a 40% better memory encoding. So they remembered words, regardless of their emotional valence. Now, when you break this down, though, the next part of the slide here, into emotional categories, there was a severe encoding impairment right here for those individuals who were sleep deprived compared to those who were able to sleep normally on their retention of positive words. So what this means is that when we don't sleep enough, we're able to not it doesn't have any impact necessarily on our ability to recall negative stimulus types or neutral stimulus types, but we're less able to recall the positive. So that means that when we're paying more attention or we're less able to bring to mind the positive when we are not sleeping sufficiently. Now let's move into some common sleep disorders. The first one being sleep disordered breathing. So here, this is characterized by either a partial or full obstruction in the airway during sleep, So this is, kind of a side shot of somebody's face. And so you might have, excess soft tissue at the back of the throat that puts a block into the airway. So obstructive sleep apnea is associated with either witnessed or reported snoring, witnessed apneas. So your bed partner might say, you know what, like you snore, 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 and then you stop breathing. So that is the apnea. People might wake up with a headache or a dry mouth. It's really hard on the cardiovascular system. So they might be waking up, just sweating, right? They're doing a lot of work to try and keep the airway open. It is higher risk in people who carry extra weight on their body, on their chest, on their airway, because, especially if somebody's lying on their back, that's just kind of putting extra pressure on the airway. But there also are anatomical reasons why somebody might have a narrow airway. So, they might have just a large neck circumference. They might have a recessed jaw, something like that. So just to give you an idea of what this would look like, people know that you can get, at-home sleep apnea tests that would test for this. What I'm showing you here is sort of the readout, the printout from one of those tests. And so what you're looking at, these lines going up and down here, this is the nasal pressure, right? And so it's just somebody's breathing. This line over here, this is your heart rate. This line up at the top, this is your oxygen saturation. If there was a line here, this is whether or not they're lying on their back. And then if there's lines here at the bottom, that's whether or not they're snoring. So this is the picture of somebody who does not have sleep apnea, okay? Now, in contrast, this is a picture of somebody who does. So this is only a half an hour snapshot of the middle of the night, but you can see here what's going on when somebody has sleep apnea. Each of these straight lines is an apnea. And each time this individual is having an apnea, their heart rate is dropping. Their oxygen saturation is dropping. So this is going to look like, somebody snore, 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 stop. And then when that stop is happening, the heart rate's dropping, oxygen saturation is dropping, the diaphragm starts to kick into gear to try and force the airway open. And then you hear this gasp, right? And then the heart rate kicks back up and has this massive try and recovery. So if this is happening so frequently, just in a half an hour period, you can understand why somebody with sleep apnea would be absolutely exhausted in the morning. It's like, they basically run a marathon at night, just trying to keep their airway open. So it's a very, very serious health concern for people. I think, probably way underdiagnosed in the province of Newfoundland and Labrador. But really serious health consequences, not only for the physical health, where it's been associated with higher rates of cardiovascular problems, but also if you think about not being able to get into certain sleep stages, it can have, big impacts on everything that I just discussed: mood, immunity, cognitive performance, and just brain health. So are effective treatments for sleep apnea. First and foremost, there's something called CPAP, which is basically just an air device that keeps your airway open. And there's lots of ways. It doesn't look sexy, I understand that. But for people with sleep apnea, it just changes the quality of their life. So if you can get over the lack of sexiness, you can say like, wow, now I can function better, right? But we also know that if the person only has apnea when they're, in certain sleep positions, maybe there's ways to always have them in a certain position when they sleep. If it does have to do more with the jaw, there's dental devices. And if it has to do more with excess tissue at the back of the throat, sometimes there's even surgery. So, the main message here is just get it treated. And this is just a little kind of comedy break here. The good news is that you don't have apnea. The bad news is that Fluffy sleeps on your face. So. Now, there is also is restless leg syndrome. This is where you have like a tingling, creeping, crawling, twitching in the feet, legs, or calves. This happens in the pre-bed time. It can lead to insomnia because you can't fall asleep. It's worsened by caffeine, alcohol, antihistamines, and some antidepressants. There are some effective treatments for that as well. So there's some medication. You can talk to your physician about it, but there's also lifestyle, supplementation with calcium and magnesium and or iron because it has a lot to do with iron as well. Periodic limb movement disorder happens at night. So restless legs happens prior to sleep. Periodic limb movement disorder happens when you like are kicking and thrashing in the middle of the night. So oftentimes it's your bed partner that reports that, like you're getting all twisted up in the covers and everything else. But those same sort of kicks can do the same thing as the apneas, where it can like pull you out of versus like certain sleep stages. So again, you can be very, very exhausted because you're having all of these movements in the middle of the night. And the treatments would be the same as restless leg syndrome. There's also something called either delayed or advanced sleep phase syndrome. These are basically just the night owls or the early birds, but it's not something that is necessarily within their control because it's a genetic thing where all of the hormones that regulate sleep are either being produced later or earlier. So these individuals can have a challenging time falling asleep or waking up at the desired or socially acceptable times. The key difference, whether or not these individuals have a sleep disorder other than delayed or advanced sleep phase syndrome is if they're allowed to keep their own schedule, if they're allowed to have whatever wake up time or bedtime they want. Do they have any trouble falling asleep or staying asleep? And if not, then it's more likely to be a sleep phase syndrome than something like insomnia. And that is the next slide. What exactly is insomnia? So this is something that I have a lot of experience with, and it is just more of a dissatisfaction with sleep quality or quantity characterized by either difficulty falling asleep, staying asleep, or waking up too early. It needs to cause significant distress or impairment in at least one area of daytime functioning, and it needs to occur at least 3 nights per week for at least 3 months. But what patients tell me, though, this is how they describe it, is they say, it doesn't matter how tired I am or how hard I try. As soon as I attempt to fall asleep or go back to sleep, my mind starts racing and I can't just shut it off. They're also able to fall asleep on the couch. And then as soon as they go to bed, that's when their mind turns on. Those are some characteristics of insomnia. So lastly, I'm going to be presenting here how to get your sleep on track. So my first sleep better rule number one, oftentimes people have mistakenly heard or been told to go to bed at the same time every night. It's actually the opposite. It's waking up at the same time every day because your wake up time determines your bedtime based on something called sleep pressure. So for example, if I'm an 8-hour sleeper, I take 8 away from 24 hours, I'm going to need 16 hours of sleep pressure to build up before I'm likely to fall asleep. So if I wake up at 7, I can go forward 16 hours, or I can go back 8 hours. I'm likely to fall asleep at 11, right? So if I decide to sleep in until 10, my sleep pressure doesn't start building up until that time. So then again, either go forward 16 hours or back 8, I'm likely to fall asleep at 2. Right? So your wake up time determines your bedtime. It's not the other way around. So that's the most important thing to keep consistent, regardless of how many hours you sleep, including weekends. This is why sometimes people experience Sunday night insomnia, as they sleep in on the weekends and then on Sunday night, they can't fall asleep. You want to make sure that you get light exposure for at least 30 minutes within 1 hour of waking up, and then getting your body moving, right? The light wakes you up, gives you energy, shuts off any of those sleep hormones that might still be in your system, and same with the movement. My sleep better rule number 2 is don't use your bed as the place you do your problem solving, your worrying, your planning, everything else like that. So your bed should be reserved for sleep and sex. That's it. Everything else should be done elsewhere, or else you eventually can condition your bed to be the place where your mind turns on. So if you repeatedly pair your bed night after night after night with thinking, planning, worrying, all of those things, that's why you can fall asleep other places, but then you go to bed and your mind turns on. So spend some time outside the bedroom, 30 to 45 minutes, do some problem solving, planning, worrying in the early evening, talk to a supportive friend, journal, all of those things, but don't use your bed to do those activities. Prior to your bedtime, establish a 90-minute buffer zone. So this is where you engage in activities that you can do in dim light that are sedentary, pleasant, and relaxing, where you're not using backlit devices. This is just to prepare your body and mind physically and emotionally for sleep. And then when you're in bed, don't try to spend time in bed trying to sleep. That's really the enemy. The more we try to sleep, the more anxious we get about sleep, the more we tell ourselves, I really need sleep. the more frustrated we're going to get and the harder it is to fall asleep. So if you're not asleep within 30 minutes or you get frustrated, going back to your buffer zone and just doing something that's pleasant, relaxing, non-stimulating, and dim light without backlit devices until you're feeling like you're sleepy again, and then going back to sleep. There are a number of insomnia DIY resources or do-it-yourself resources. These are a few where if insomnia is your concern, these are some great sort of workbooks and handbooks you can take a look at. There's also, if insomnia is your concern, a worldwide directory, because I know that some of you will be joining us from places other than Canada, of people who provide a treatment called cognitive behavior therapy for insomnia, which is currently the gold standard non-medication based intervention for insomnia. So there's that website to be able to provide you with that resource. And then that is it. I hope everybody sleeps as well as this kitten. Thank you.
Hi, sorry about that. Having had a little trouble unmuting myself. Thank you so much, Dr. Garland, for that incredibly informative and fascinating presentation. We've got lots of questions. Before we get to our Q&A, I just want to very briefly thank our sponsor for today, which is Johnson Insurance. Johnson Insurance offers Memorial University alumni specially designed policies and preferred rates on home and auto insurance, as well as travel insurance. So there's a number there on that slide, or you can visit the Johnson website for more information. Now I'm just going to pop up our question slide and we will get right to it. 1 second, there we go. Okay, first of all, let's start with, we had 2 questions about menopause and menopausal insomnia. So what are your thoughts on hormone replacement therapy in perimenopausal women to resolve sleep issues? And then a kind of additional question to that is do you have any specific suggestions for menopause related insomnia?
Yes. So with regards to hormone replacement, that's a question you'd have to take up with your physician because there's some risks associated with that. But I do have some specific suggestions with regards to timing of medications. Sometimes there are medications like even Effexor can be very helpful for menopausal related hot flashes. And there's other medication treatments that you can talk about. Taking those can sometimes reduce the frequency of the hot flashes. But there's some things you can do to your sleep environment that can help. Making sure your sleep environment is cool. Really, really important. There's also pillows that keep your head cooler because hot flashes can sometimes start in the head and the face, right? So they kind of flush that way. So those pillows, one of them was marketed brilliantly. It was called a chillo, right? Which is just kind of keeping your head cool. So that was one thing that I saw. But those have some evidence to help making sure that you are wearing clothes to sleep in that don't trap the heat. So cotton is not your friend here. So like wicking material is much more helpful. And then yeah, making sure you've got a really cool environment.
Okay, great. Thank you very much. I'm going to get a chillo. Is it possible to get eye headaches, for example, eye strain from rapid eye movement from REM sleep?
That's an interesting question. It's nothing that I've ever heard about because it is it's something that we just do very naturally. It was discovered by looking at the eyes of babies, right? Like because babies spend an incredible amount of time in REM sleep for their brain development, right? So it's not something that I've ever heard about. I've heard people feeling like they're tired because their dreams are so intense, right? But nothing that I've ever heard about that would get eye strain.
Okay. Can regular sleep paralysis be a trauma response and or related to stress levels or anxiety?
Hmm. So trauma and sleep has a whole nother, that's a whole nother thing because it really depends on um types of trauma. I would say, like, if there is something like that, seeing a mental health provider, a psychologist that has specific experience in working with trauma might be the best resource for that, because there are other sort of like sleep terrors. There's hypervigilance that's associated with trauma at night. So if somebody has had a trauma experience and is experiencing sleep paralysis, um, those two things may or may not be connected. Sleep paralysis itself doesn't indicate some sort of trauma, because it's totally normal, and happens all over the world in all humans. But if there has been a trauma, that could be influencing a bit of it. So making sure you get some assistance with that would be helpful.
Okay. When people report having issues staying asleep, but no issue falling asleep, what's going on there?
Mm. Sometimes they're going to sleep too early. So, what happens is when we don't have enough sleep pressure that I said sort of built up, we can experience gaps in our sleep. So, we won't have any trouble falling asleep, but then we'll have a gap in our sleep awakening during the middle of the night, and then we'll fall back asleep. But sometimes, if you calculate how much time you're spending in bed, like maybe you're going to bed too early. So, for example, people going to bed at, if you're a 7 hour sleeper and you wake up at 7, but you're going to bed at 10, right?
Hmm.
If you're doing the math, that doesn't work out. So you might be able to fall asleep at 10, and then you sleep for 3 hours, and then boom, you're awake. And then you're awake for 2 hours, and then you sleep a little bit longer, and then you wake up at 7, right? It's because the person is spending too long in bed for their total sleep need. So if they're a 7 hour sleeper and they wake up at 7, they should be going to bed at midnight. And then that sort of sleep pressure would actually squeeze out that period of awakening, and allow them to have a more consolidated period of sleep instead of the broken up sleep. So people actually, when they experience those periods of awakenings, they say, oh, I better go to bed earlier and try harder to sleep so I can get more sleep. And it's actually backwards. It's they need to sort of give themselves more sleep pressure. They need to be sleepier when they go to bed so they can go into deeper sleep, stay in deeper sleep longer, and feel like that's more restorative.
Okay. Back to my list. Is there anything we can do that impacts our level of stage 3 sleep as we get older? Or is it just something we have to get used
Physical
to?
activity.
Okay.
So, the more active you are, the more you're putting good stress on your body. The more your body is going to respond to that good stress and give you that deeper, good quality of sleep. So, physical activity has been shown to help with that amount of time spent in deep sleep.
Great. We've had several questions about napping. Here's a question: can time asleep be cumulative? For example, you sleep 5 hours per night, and then you have 3 hours worth of naps during the day. And what's the best or optimum amount of time to nap for?
Yeah, so the two questions are there. So one of them is it doesn't have to be all in one chunk. And there's some suggestion that evolutionarily we never used to sleep in just one segment, that we used to sleep in broken up, like almost kind of biphasic sleep, or like you'd have, a period of sleep, you'd be awake, and then you'd have a period of sleep. It wasn't until we had artificial lighting, that we could actually sort of consolidate our sleep into one period. So there's nothing saying that you need to have all of your sleep in one period if your life allows for more kind of segmented sleep. And so it's really more about the sleep that you're getting over a 24-hour period. So if you're getting your total amount of sleep that you need over a 24-hour period, but it's kind of broken up, and you feel good about that, great. That's often a time, like people who work shift works. Sometimes they'll sleep prior to their shift and before and after their shift, and kind of broken up, and they'll get their sleep need met at that point. With regards to napping, you want to make sure that naps are under 30 minutes. You don't want to, in order to get the restorative benefit of a nap, it needs to be short because you don't want to get into that deep, slow wave sleep, or else you're going to feel worse after the nap. And you don't want to have your nap too close to your sleep period. So that's why it's like late morning, early afternoon is kind of a good time if you're going to have a nap. Like, put your head down and have a 30-minute nap, but set an alarm so you don't end up 3 hours later going like, oh, okay. Because if you sleep too long, it's just going to impact your ability to fall asleep that night because you have discharged too much of the sleep pressure.
Great. Does the need for sleep increase for people with an acquired brain injury or those diagnosed with Meniere's disease?
So there is some evidence, especially after acute brain injury, right? It's just trying to, or any sort of like assault to the system, right? Our body is going to respond by trying to use sleep as a way to recover, right? So any sort of physical illness or injury is often, for some period after associated with like more a greater sleep need. um and I think, like, with something like an acquired brain injury or traumatic brain injury, you're just using sleep as that like buffer. You're trying to use it to help the rest of your system function.
Okay. Can someone be a snorer but not have sleep apnea?
Yes. Yes, absolutely.
Okay,
Yeah,
very good.
yeah. So just because you snore doesn't mean you have sleep apnea. But if you snore and you are really tired during the day. So people with sleep apnea often find themselves like excessively sleepy. They're the ones sort of in my, clinic waiting room falling asleep just waiting for their appointment, right? Those are the people who would be more concerned about who are snorers and also have sleep apnea.
What additional resources are available for children who struggle with staying asleep?
Depends on the age. So because it's so developmentally different, so a lot of times for the younger kids, it's really about the parents setting the stage for the children. For kids who are like at in the adolescent range, they experience a natural phase delay. So when I described the delayed sleep phase syndrome, so teenagers normally, naturally, their biology actually shifts their sleep phase later. So they're not actually biologically primed to fall asleep until later and wake up later. So if they're teens that this person is referring to, there's a whole nother thing about trying to optimize their sleep and trying not to set things in the morning like early school times or early commitments for practices and whatnot, because that is going to compromise their ability to get the sleep that they need. But I guess I was going to send out, Janet, some sleep resources afterwards to everybody. The Canadian Sleep Society has a great website with evidence-based resources for promoting healthy sleep across the age range.
Right. Okay.
They'd be a
Perfect.
great Canadian resource.
Okay. Here's a question about delayed. Is there a treatment for delayed sleep phase disorder? And are there any sleep clinics in Newfoundland and Labrador?
So yes, there is treatment for delayed sleep phase, and but I think that that's working against your biology. If at any if you can work with your biology and structure your life around your sleep phase, it's just much easier on you and your body to go with what's natural for you.
Mhm.
If that's not possible, treatment involves chronotherapy, which is just trying to use melatonin and light to trick your body and brain that you want to fall asleep earlier. But it's really hard for people to sustain because as soon as they don't use those artificial signals, their body just slips right back. So there is a sleep clinic in Newfoundland Labrador. So there's referrals available from your family doctor. Delayed sleep phase isn't something that needs to be diagnosed in a sleep clinic, though. Those ones are more likely to be for sleep-related breathing disorders or movement disorders, things that you need like measurements on. So there could be other providers like myself that would be capable of diagnosing other sleep disorders.
Can you speak to how important sleep is for new parents as well as to their baby or their child?
Yes. Yeah. So, it's where I talked about, having light sleep and different sleep stages, new parents as a biological necessity, right? It's almost like they don't get necessarily into the deeper sleep because of that hypervigilance. Like I need to be awake if the, baby needs me or something like that. So there is this process of adjustment, definitely, that happens. So, the biggest thing would be the trickiest thing for new parents is lack of support, right? Like, so where you can trust that somebody else can take care of your child while you sleep. In the absence of that sort of support, either by family members, partners, or anything else like that, it's just really, really hard on new parents. If there are two parents that are available, taking shifts, even where like if depending on how the baby is fed, the father might be able to bring the baby to the mother to be fed and then bring the baby back. So the mother is still able to sleep, at least having some of that recovery sleep. So working in shifts is really one of the best ways. So both parents can maintain their health or getting other support.
Right. Well, I think we're going to have to end it there. We do have some more questions, but I mean, it's 2 o'clock, and I have to thank Dr. Garland so much. That hour went by like I have no synonym for that. Do you have any final words, Dr. Garland, for our audience on sleep?
Like I would just say that, based on the attendance here, it's obvious that, sleep is important and sleep is something that people are paying more attention to now and as they should. It really is the foundation for all other health behaviors, right? If you're not sleeping well, you're not going to be exercising, you're not going to be making healthy food choices, your mood is going to be impacted. So I'm really, really, I guess, impressed, really happy that there was such an intention on healthy sleep. And I would also say that we do need more resources. I see a lot of comments on like, access to therapies and treatments and stuff like that. Compared to other provinces, we don't have enough. And so we need more advocacy in this province to be able to increase access to evidence-based treatments, therapies, diagnoses, everything else. So that's one of the things that I'm working on as well through my position.
Well, thank you so much. And we really appreciate the work that you're doing. And thank you to everyone who attended this webinar and for your great questions. Just a heads up, if you enjoyed today's event on December 7th, Dale Jarvis is going to be here discussing Newfoundland and Labrador holiday traditions. And we're also going to learn about the legend of Santa Claus from folklorist Dr. Daniel Peretti. And our final Coastlines Book Club event for 2021 will be held on December the 14th. And we're discussing Us Now, which is a collection of stories from the Quilted Collective about the reality of being a racialized Newfoundlander. You can register for both these sessions on www.mun.ca/alumni. As I indicated earlier, this session has been recorded and you'll be receiving a link in an upcoming email with some additional resources from Dr. Garland. So please keep your eyes on your inbox. And don't forget to subscribe to our Alumni Engagement YouTube channel so you can catch all the webinars that you might have missed. But I'd like to I'd like everyone to have a great day. And thanks for joining us. And that's it.
Thank you, everyone.